Seems safe. Seems say yes. Mechanism injury, vehicle ejection. It's a smaller patient. Yes, it is. Go ahead and call ALS and activate them, get them en route. I'm going to go ahead and have my partner holding line manual stabilization because obviously he's got some C-spine precautions we need to take. Next thing I'm going to do is, sir, are you okay? My general impression is I have a 30-year-old male found in a supine position. Mechanism injury was a vehicle ejection. Chief complaint unresponsible. I'm going to go ahead and have my partner do a jaw thrust method. I'm going to look, listen, and feel. Do I have any breathing? And say, yeah, you have some breathing. Great. I'm going to go ahead and look inside my patient's airway. Do I see anything? Nope, it seems clear. Great. I'm going to go ahead and drop in an OPA. Does my patient tolerate it? He's going to say, yes, he does. Say, all right, great. I'm going to go ahead and assess my patient's breathing. Can I get his rate, rhythm, and quality? You're probably going to get something like 8 shallow and labor. All right, great. This time I'm going to go ahead and apply a BVM, high flow O2. I'm going to bag this patient 1 breath every 5 to 6 seconds. 10 to 12 breaths per minute with 100% O2, 15 liters a minute. Does that seem to help? How's my back compliance? He's going to say something like, he's either going to say you have good compliance, he's going to say you're having some problems on the left side, or you're not doing too good. All right, great. I'm going to go ahead and expose my patient. Nose and navel, I'm going to do a quick nose and navel inspection. Do I find anything? There should be moulaged up. You should have some type of significant bruising or a sucking chest wound. For the purpose of this, we're going to have a flail segment. All right, for a flail segment, I'm going to go ahead and apply a bulky dress. I'm going to take this patient 2/3 of the way around, ensure not to tape the unaffected side. Does that help my back compliance? How's he doing now? He's doing a lot better. Okay, great. At this time, I'll go ahead and get my patient's pulse, rate, rhythm, and quality, please. He's going to give you a rate, rhythm, and quality. He's going to say noted. I'm going to go ahead and get my patient's skin color, condition, and temperature. He's probably going to tell you cool pill diaphoretic. Great. I'm going to go ahead and completely expose my patient. At this time, do I have any major bleeding? And he's going to say no. Great. At this time, I'm going to go ahead and determine this is a priority patient. And I'm going to go ahead and do a rapid head-to-toe trauma assessment. This time, I'll go ahead and bust out my DCAP BTLS. I'm looking for deformities, contusions, abrasions, punctures, bruising, tenderness, lacerations, and swelling. Do I find anything in the head and neck area? No, I don't. Great. After I'm going to look for tracheal deviation, JVD, nothing. I'm going to go ahead and measure for a C-collar and have my partner apply appropriately sized C-collar. I'm going to go ahead and decap BTLS the chest and thoracic area, ensuring to stay away from the affected side. Go ahead, decap BTLS. Do I find anything? Nope. All right, great. I'm going to go ahead, palpate my patient's abdomen, all 4 quadrants. Do I find anything? Nope. I'm going to go ahead and sweep for a priapism. I'm also going to check for any genital issues or bleeding or anything. Do I find anything? Nope. I'm going to go ahead and palpate my patient's lower extremities, check for decap BTLS on both sides. Do I find anything? He's going to probably say, oh, you got some crepitus or whatever. Okay, great, noted. I'm checking for pedal pulses in both feet. Do I have pulses? Yes, they are present. Okay, great. On my way up, I missed the pelvic girdle. I'm going to go ahead and check for stability. It's good. All right, great. I'm going to go ahead and decap BTLS, the upper extremities. Do I find anything? Probably crepitus or whatever. Okay, noted. I'm going to go ahead and check for pulses. Are they present? Yes, they are. Okay, great. At this time, I'm going to go ahead and have my partner help me. We're going to roll this patient on the side and we'll check his back because I'm probably not going to see his back again. On the headman's count, 1, 2, 3. Roll the patient over. I'm going to check the back of the head, the back of the neck. I'm going to check the spine for any step-ups or step-downs. I'm also going to feel for any crepitus or decap BTLS. I'm also going to check the anal area. I'm looking for any bleeding or seepage or anything of that nature. Do I find anything? And then I'm also going to check the back of the legs. Do I see anything? Nope. This time I'll go ahead and insert a backboard and put this patient on the backboard on the headman's count. 1, 2, 3. Great. This time I'll go ahead and package this patient for transport. I'm going to have my partner obtain a baseline set of vitals, and he's also going to try to obtain a sample history. Do I get anything? He's going to tell you no. Great. I'm going to go ahead and continue to transport this patient as a priority. I'm going to go ahead and start my detailed physical exam en route to the hospital. I'm going to start with the head for decap BTLS. I'm going to look behind the ears for vital signs. I'm also going to check the ears to see if I have any drainage or leakage. I'm going to look in the eyes for raccooning. I'm also going to check the eyes for pearl. Do I have pearl? He's going to tell you yeah. I'm also going to palpate around the eyebrow and in the eye orbits to make sure that I don't have any crepitus or anything. Do I find any decap BTLS? No. I'm going to check the nose to make sure it's in line. I'm going to remove my mask momentarily. I'm going to open the patient's mouth. I'm going to inspect inside the mouth to see if I find any teeth or anything like that. Do I find anything? He'll say no. I'm going to go ahead and reapply my bag. Continue to bag this patient 1 breath every 5 to 6 minutes, or 5 to 6 seconds, 10 to 12 breaths a minute, 100% O2, 15 liters per minute. Is he still tolerating that? Yes, he is. Great. I'm going to go ahead and down to my shoulder girdle and check for rigidity and stability. I'm checking the clavicles, make sure they're good. Do I find anything? So I say no. I'm also going to check for tracheal deviation or JVD. Do I have anything abnormal? No. Great. I'm going to go ahead and palpate my patient's chest area, staying away from the affected side still. Do I find any decap BTLS? I'm going to go ahead and auscultate the 6 areas in my lungs. Do I have any abnormal diminished sounds, or do I find anything abnormal? He's going to say, yeah, you have some diminished sounds to the affected side. Noted. That's normal. All right. From there, I'm going to go ahead down. I'm going to palpate my patient's 4 abdominal quadrants. Do I find anything? Look for rigidity, swelling, pulsating masses, anything of that nature. No? Okay, great. I'm going to go ahead down to my patient's pelvis. I'm going to squeeze the pelvic girdle to make sure I have stability and rigidity. Is it good? I'm also going to check the genital area again, so for priapism. I'm also going to check for any type of genital injuries, bleeding, or anything of that nature. Do I have anything? Then I'm going to go ahead and palpate down my patient's legs. Do I find anything? Here, he's going to tell you have some capillary bleeding or some type of crepitus. I'm going to say, great. I'm going to have my partner go ahead and properly manage these injuries. And then I'm going to move on. I'll go ahead and palpate the other leg. Do I find anything? If he says anything, again, I'm going to have my partner go ahead and properly manage these injuries. I'm going to check pedal pulses. Are they present? If he says no, I'm going to move up to the femoral. Is it there? Can I find it? If he says no, I'm instantly going to go to the carotid. He'll tell you have them. You'll get them right here. Does that make sense? All right. So from there, I'm going to come up, decap BTLS my patient's upper extremities. Do I have anything? If he tells you yes, he tells you what it is, great. I'm going to have my partner go ahead and appropriately manage those injuries. I'm also going to check for pulses on the patients. Are they present? Yes, they are. Great. This time, we'll continue to transport as a priority. I'm going to reassess my patient's vitals every 5 minutes en route to the hospital. I'm also going to be prepared to treat for shock. And I will reassess my initial assessment and continue to reassess my patient often.